Thank you to the committee and to Sages for letting us present our work here. Hopefully it will stimulate some discussion amongst the 5 or 6 people in the audience and hopefully the surgical community as a whole. These are the authors on our study. We have no disclosures. You're from the South. I put a built-in timer on this for you. So we have had at Houston Methodist for 28 continuous years an advanced MIS program, been a continuous operation the whole time. But as you can imagine, during that time, the level of difficulty in our case mix has gone up quite a bit as well. In the faculty practices, 30 to 40% of our cases are reoperations, and we operate on the GI tract from the esophagus to the rectum. We do solid organ, we do everything. The other thing we noticed was an increasing mismatch between the skill sets of the incoming fellows and those that we desired and or required as faculty to consider our fellows successful in the program. So we set out to redesign the entire matching process. Previously, we used standard in-person, unstructured one-on-one interviews. So you might tell me, Dr. Reardon, I like barbecue and cowboy boots, and I'd say, well, you're in. We looked at your ABSITE scores, letters of recommendation, and case logs. But we got quite serious, and we engaged a company that has a commercial product called SurgeWise. Structured interviews. If you look at the table, you can see it measures your non-technical skills, and really those are the values and characteristics we look for in fellows. So it measures them and ranks them. And if you didn't align with the faculty, because we all took the same test and they made an avatar of us, we didn't even invite you. And then we did in-person off-axis testing on a box that we call MAD Skills. This is something that I developed back in 2010 and we presented at 2011 in Sages. We used the FLS rules and we tested on FLS Task 1, which is peg transfer. You have to have good coordination of both hands. And FLS Task 5, which is intracorporeal suturing, which is a skill we do every day. And all the scores were kept on a database in the sim lab. So here's the results. We had 3 years of testing before COVID shut us down, and we were able to test 39 candidates. We tested them all on Task 1 and 5. For the peg transfer, 76.9% were able to make it to the 90-degree station. That is to say that they transferred those pegs at 90 degrees. 8 candidates failed at the 45-degree station, meaning they couldn't get past it, and only a single candidate couldn't get past FLS level. However, when we looked at intracorporeal suturing, we were sort of shocked and surprised, but it did explain some of our dissatisfaction. Out of 39 senior residents, 38.5% of them could not pass Task 5 FLS, which would mean you could not graduate from your residency, couldn't drive a needle and throw 3 throws in 5 minutes of the time this talk's going to take. If we tested non-integrity, they got a 61.5% failure rate. And finally, we moved them off Axis 1 station, which is how we operate every day when we suture, and we had a 77% fail rate. So during this 3-year cycle, the way we felt like it improved our satisfaction was we did not rank or try to match any candidates who could not complete FLS. This was a hard stop. No matter how much we like you otherwise, we would not take you. And we felt like we did fairly well. The 6 candidates matched during that 3-year period. 4 of them made it past the 45-degree station. So we felt like it minimized but didn't completely eliminate the time and effort we had to spend on remedial training. We would sometimes spend 1 or 2 quarters out of someone's year trying to get them up to chief resident level. So we decided that in our program, we thought the non-technical skills, that can be done remotely. Those are surveys, you can do them by Zoom. But we didn't see a way that you could get your technical skills tested since we were using in-house off-axis. And in fact, this is a better name for our study, and this is what the manuscript calls it. We discovered deficits in the senior surgery residents. And so we believe that a more real-world off-axis test is needed, and if you hadn't heard about it, we have engaged the ATLAS, the Advanced Training and Laparoscopic Suture Training Program. It's all off-axis. And a really hard subject for us, and we're going to deal with this at home, is perhaps the faculty who train our residents in both basic and advanced MIS, they may need to be tested and then trained or retrained as needed in off-axis skills, because if they don't use them, we can't expect the residents to. And finally, we thought we should start at home in terms of trying to do what we think is right. So currently, our program director and associate program director are in discussions, and our current goal is to push this training down into your intern year, and we want them to start early, start off-axis, and test frequently. And I wanted them to test every quarter. I'm not sure I'm going to get that, but maybe twice a year. And we put our money where our mouth is. I had already purchased 1 ATLAS skills modules, all of them, and we've purchased enough now to train all our residents. We just put them in our off-axis boxes. Thank you very much.
Thank you. you want to